wealth of knowledge and problem-solving skills amongst your staff that you have not even found yet. By allowing people to make their own decisions and problem solve right on the unit, you are going to make great strides to things that you may have been trying to change for a long time.
Releasing Time to Care was developed in England by the NHS. It aims to empower staff to identify areas for improvement on the unit and provides tools to accomplish these goals.
I think the key is it focuses on being led by the staff. It speaks to the staff who are actually looking at driving this work.
It's about releasing more time for direct patient care, which after all is why nurses come into the profession.
We have gone from a culture of, I can't do anything differently, this is how it has to be, to striving to make better for our patients, looking every day for solutions that can make things different for them.
On our floor, it's been the leadership from the frontline staff. It has changed the way our culture is completely, and it spreads. It's all the staff. It's not just the nursing staff, even though it's on the nursing ward. The entire facility, because we're a small facility, wants to be involved.
I'd say the biggest change is we now have a way of communicating issues on the unit and a way of coming up with ideas and actually seeing those ideas be put into practice.
We've had a lot of changes. Some of the drastic ones have been, we have patient medication carts. We've actually created stationary med carts that live outside of all of the individual rooms. You can gather your stuff right at the point of care, which has been really fantastic, and we've saved that 20 minutes a day that we were doing in the beginning where we'd move carts around and stuff. We were finding that when we were admitting patients onto the unit, the nurse was off running to the clinical room, gathering supplies from all different places. So we've decided to gather all of that material into one that we call an admit kit. So now when we admit a patient onto the unit, you grab one bag and it has absolutely everything that you need to safely admit that patient so that you can be there at the time of care.
Every area and every level of patient care has been increased. When you take 10 minutes to find something in a hold to do a simple wound care process, whereas now I can go outside my door, go to the cart, grab what I need and go in. The time I get to spend with my patient is quadrupled in a year. And that, me being at bedside, equals good care.
Since we've had Releasing Time to Care in place, we have had an increase in awareness. We collect our own data, and from that we have decreased our patient falls, we have decreased our UTIs, we're working on pneumonia. Our general awareness of safety has improved greatly.
I think at the end of the day, this is a very simple approach and it can be adapted in any country, in any health system.
Releasing Time to Care is an excellent way to move along improvements on a unit. We just listen to them and we help them overcome any barriers and making the improvements that they suggest.
There's lots of tools out there, lots of projects, but Releasing Time to Care is about the voice of the nurse who's at the bedside, and if you help her to do her job better, everybody wins.